Hello, my name is Jill Janisi. This is the Icebreaker Get to Know Your Peers video. So I have written down the questions with my answers. Where do you work? I currently work at an outpatient facility as a registered nurse. My working experience has been I started off as a CNA, which is a certified nursing assistant. I floated, I was mostly on the medical surgical floor, but then I floated to the ICU, the ER, and even the locked inpatient psych unit. When I finished my nursing degree, I started off as a flu clinic nurse. Then I went to floating, and I floated to various different departments, the endocrinology department, cardiology. I did triage, and then I ended up in the outpatient psych floor. I did both inpatient and outpatient as a registered nurse. Currently, I'm an outpatient. I'm from Massachusetts. I still currently reside in Massachusetts. My hobbies include traveling when I'm able, family adventures or events. I'm very passionate about animals and dogs, and I have two of my own, so I also like to do things with them. If I had more free time, I'd probably like to volunteer at shelters. I also like arts and crafts, doing little projects here and there when I'm able, and I do find researching interesting. So at night, sometimes I'll do some researching of certain topics I think about throughout the day. Something about my family. Um, my grandmother started a tradition that once a week we would have a big Italian family dinner, and that would include aunts, uncles, cousins, extended family. That tradition has still carried on, although my grandmother has passed. My aunt and my mother took over. So currently, every Thursday, my family and I get together for dinner. One thing about me that many people don't know, there's not much because I'm very open and very predictable. I'd have to say I don't think people know the extent of my passion for animals or dogs. I also don't think people know that when it comes to watching TV, if it's not a realistic show or movie or a psychological thriller that is about criminals or mobs or drugs, I'm pretty much not interested and I really don't watch much TV. My nurse practitioner concentration and why. So I am enrolled in the psychiatric nurse practitioner program. I find it fascinating and um, working with these particular types of patients or population. Um, what made me move forward with concentrating on this specialty was when I've always liked it, but when I was asked to, as I was a float nurse, since I was the float, I was asked to go to the outpatient psych floor and conduct a pilot to get basically prove to the board that we needed more nurses and have to prove to them that the work outweighed the staff that we had. I was able to prove that, and while I was there, I was very much blown away by the providers that were working there, the psychiatric nurse practitioners, the psychiatrist, the psychologist, the therapist, all of the staff, and the tremendous amount of successful patient outcomes that I witnessed while I was there. And I just was completely moved and I knew that I wanted to do that type of work. Also, myself, I've experienced anxious moments, as I think most people have. Um, and I think that getting mental help is just as important as getting physical help for a medical ailment. And I think that should be incorporated or integrated with each other. Um, So I think that's my why. And just to be able to actually have the tools to administer to someone when they are in anxious moments or grieving moments or hallucinating moments, manic moments, whatever it may be, that I could provide tools and education or medication or therapy or whatever it is to help reduce those feelings and symptoms. And the last question is my career goals. My ideal job would, as this is my career, would be to work with young adults or middle-aged adults. Being a psychiatric nurse practitioner, the only thing I'm undecided on is I'm unsure if I want to do inpatient or outpatient. But currently, I've been working in outpatient. I do like it a lot, and I feel like I'm leaning more towards outpatient than inpatient. I think I answered all of the questions. So thank you for watching, and I'm looking forward to learning with you all.